A lot of patients, sometimes their relatives just think that liposuction is very easy. You come here, get your surgery done. But what they don't understand is how the assessment, how the planning of surgery is done. How do we plan each patient's results so that they get what they deserve, what they desire? So let me take you through how I do consultation of my patients. So come here, watch my iPad. So first of all, when a patient comes, we explain them that what is the subcutaneous fat and what is the visceral fat above the muscle and below the muscle. We also explain them what are different technologies we use, whether they need the use of these technologies. One is micro-air, the other is laser. We mark what all technologies are to be used in that patient. In case that patient needs radiofrequency skin tightening, we also mention that they need a body tight. We also ask about their history, whether they are diabetic, hypertensive, any long-term illness, any surgeries, any allergy to any medicines. If they smoke, they take green tea. If they have any psychiatric, psychological illnesses. In case of female, whether they want for the kids, pregnancies, and if they've had massive weight loss either by diet, exercise or bariatric surgery. Then we take them for examination. Now while examining, what all we will note? First of all, the areas, what needs to be done. So I mentioned what all areas need to be contoured. Then we also note what is the skin quality. Do they have stretch marks? If the skin is very thin, if the skin is very thick, what is the consistency of the skin and the tissues? If they have any cellulite, if they have asymmetries, this is to be important because some patients may have a slight amount of pelvic tilt and they might have asymmetries. So it helps if you note it down so that you can plan the procedure so that we can try to achieve as much symmetry as possible. If they have any previous scars from any surgeries, if we are talking about abdomen, if the patient has any hernia, this needs to be taken care of because if there is a hernia, we can't do liposuction around that. We should avoid doing that. In fact, we also have to plan to repair that hernia at the same time. And whatever fat we are removing, do we need to reuse that fat to enhance other facial body parts? So fat can be used as fat transfer method to enhance that. So all these points are noted. Once that is noted, we get a treatment plan which is made. At the same time, if a patient needs an abdominoplasty, we assess them and do markings of the abdominoplasty, whether they need a mini tuck, whether they need a full tummy tuck, or they need a total body lift. All that is mentioned on their prescription depending upon their examination findings. So it's not just come here, do liposuction, go. It's planning. Unless you plan, you don't get the desired results. And then what we do, we examine the patient in front of the mirror, show them what we are doing, and then also examine them on their pictures. I'll give you an idea. So suppose this is a patient, we need to examine her, we need to plan her abdomen. So we will tell her where her bones are, how much amount of fat we can remove, what we can contour. So I can draw that this is the kind of silhouette she wants. We can also decide if she needs the abdominoplasty, where will be the scar. So I'll mark the scar so that the scar comes there only. We also will discuss the shape of the navel and the position of the navel. So if this is the thinnest part of the waist, we'll try to keep navel just 2 centimeters below and a vertical looking navel. We also will then talk about how we will try to contour her and give her a high definition result. So the central depressions of muscles, the edges of muscles, all that can be discussed. And that's the scar. At the same time, we also will discuss how will her result look like if we see her from her back. So we can discuss that this is her fat which needs to be removed, this is the arm fat which can be removed, this is the back fat which can be removed. So all these things are done, how to contour this lower back, everything is discussed. And if she needs a fat augmentation in the butts, we can also talk about that she has hip dips. I can add some fat here, I can add some fat here, and this is how we will design and sculpt her body shape. What this does is, This actually gives a patient a very clear-cut idea of what we intend to do. It also gives us an exact details of examination findings and treatment planning along with the patient. She can point out that I don't want this area to be contoured, or I want this area to be contoured, and all that is noted. And at the end, this all prescription, which is all digitized, is sent to the patient in a PDF form on their mobile as well as email, so that they can always go back and have a recall and check with it and come back to us if they have any questions. Before we wind up, we also tell them if they need any investigations. So we also mention if they need a hemogram, a blood test, whatever test, X-ray, ECG, ultrasound, everything is mentioned in this all document. So this is how we do a detailed consultation for any body contouring procedures. I hope you understood it's much more than just doing liposuction. It's all about sculpturing, and you only get a good result if you plan well. It is said, if you fail to plan, you plan to fail. So this whole consultation helps me plan my surgery, my exact surgery for any particular patient. If you have any more questions regarding this surgery or any other cosmetic surgery, please connect with us. Me and my team are always there to guide you honestly and scientifically.